Slavery is back.
Welcome to a place where private business profit from a captive labour force, yet pennies are spent on medical services to a population in which the Indigenous, the poor and the mentally ill are overrepresented. Where isolation, humiliation and degradation are facts of life. Welcome to prison.
It depends who's telling the story, I suppose. The prisoners would have one view, the people who work in the prison system would have another, and I think it's up to people to decide where the truth is.
Give government propaganda and the media spin doctors the flick. And check out Doin' Time for news, views and tunes on prison issues from Guantanamo Bay to Christmas Island to prisons and detention centres everywhere. Every Monday at 4 p.m. on your community radio 3CR.
We are still fired up and we're still talking about revolution.
Hello and welcome to the Doin' Time show. This is 3CR Community Radio, 855 AM on the dial, streaming live on www.3cr.org.au. This is Marisa and I'll be taking you through until 5 o'clock this evening. And I just wanted to give a very special thank you to all our listeners and supporters and friends of 3CR who donated to the appeal, despite the fact that we're in the middle of a pandemic and that there's been very, very tough times. 3CR supports vulnerable communities and is committed to working with communities and individuals who are deprived of a voice. It's approximately 4:02, and we've got an interesting show planned, to say the least. First up on the show, we're going to be speaking with Meg Hill, who is from the Refugee Action Collective. And indeed, today's show is committed to looking at vulnerable communities in the context of the coronavirus, and also looking at over-policing, but also discussing public health issues and how we can actually overcome this pandemic. So first up, we'll be speaking with Meg Hill, and she'll be speaking about a media release that's been produced by the Refugee Action Collective, and it's entitled Detention of Refugees, a Blind Spot in Hotspot Suburbs. As Melbourne experiences a spike in COVID-19 cases, refugees remain locked in unsanitary and crowded conditions in the city's north, with hotspots popping up around them. Meg will be speaking about the 65 refugees who have been held in the Mantra Bell City Hotel for almost a year, and these people have serious underlying health conditions caused or worsened by years of detention offshore. The hotel is only a few blocks from Reservoir, one of Melbourne's virus hotspots. So she'll be talking about that shortly, about how also refugees are being held in the MITA Detention Centre in Broadmeadows. And we'll be talking about that very soon. And then after that, we'll be speaking with Tamar Hopkins, who is the former Principal Solicitor of Flemmington Kensington Community Legal Centre. And she'll be speaking about the hard lockdown that's happened with the residents of Flemington. And this is in the 9 towers that's happened in the public housing system. And we'll be talking a lot about the complex issues of over-policing and looking at vulnerable communities, and also discussing the public health crisis and what can be done. So, without any further ado, we'll be speaking now with Meg Hill from the Refugee Action Collective. And just a brief thing as well, that Tamar Hopkins, who's next after Meg, has also done extensive research in the area of over-policing, and we've interviewed her extensively on this show in regards to racial profiling and some of the cases that have emerged about that around discrimination. And so it'll be Meg Hill up first.
In 2020, 3CR is delivering our Beyond the Bars project differently. We've been speaking to the Indigenous men and women in Victorian prisons over the phone, and we'll bring you those chats throughout the week of Monday, July the 6th to Friday, July the 10th. You can also catch up on the audio from the project online at 3cr.org.au/Beyond the Bars 2020. We want to see our men and women out of the prison system, but while they're still there, we will give them a voice through Beyond the Bars. Make sure you listen in.
And in case people have just tuned in, this is the Do and Time Show 3CR, and you're about to listen to an interview with Meg Hill from the Refugee Action Collective. Hello, Meg. Welcome to the program.
Hey, thanks for having me.
Great to have you. And Meg, it really has been a terrible ordeal, hasn't it, for the refugees in the Mantra Hotel. While the Victorian government addresses the spike in cases in the community, the refugees in Mantra and Meta are being deliberately left in high-risk environments. Can you talk about that?
Yeah, so refugee activists have said since the start of this pandemic that the conditions that refugees are held in Victoria and Australia broadly are totally unacceptable and actually are an imminent infection threat. So not to get into the issue of the lockdown and the way that the government is dealing with the crisis more broadly in the suburbs, but there are two detention facilities essentially in Melbourne's north where some of these hotspots are occurring. So there's the Mantra Bell City Hotel in Preston, which, like you said, is a few blocks away from Reservoir, which is not under lockdown yet, but is identified as a hotspot. And then there is the MIDA Detention Centre, which is in Broadmeadows, which is under lockdown and is one of the worst hit areas of Melbourne. And there's a whole bunch of different factors that make these facilities really unsafe. And they've been unsafe and a threat to the lives of these refugees before the pandemic. And that's a thing that we always have to say, which is that it's not just because of COVID that we are asking for these refugees to be released. We're for their release unconditionally at all times. But there are a lot of factors that make it a lot more dangerous now, including the crowded conditions, the lack of care that they're given, the food that they're fed, the security companies and the security guards that are there, and the fact that the people in the Mantra Bell City Hotel all have underlying health conditions, which is the reason that they're currently being held in Melbourne. Absolutely. And so with the refugees, and I understand that there's been a lot of protest, with the Refugee Action Collective and other organisations, how long are these asylum seekers going to be held in the hotel, Meg? Is it indefinite? Yeah, so the government is kind of refusing to say, and the situation with COVID has made it more difficult because I guess the reason that they're being held in the hotel, the refugees in MIDA are kind of separate. They're kind of a separate category. So they're here for a variety of different reasons. But in the hotel, those refugees are here because they were brought here last year, most of them a year ago almost, under the Medivac legislation that was briefly legislated and then repealed. So that legislation made it a bit easier for refugees to be brought to the mainland for medical treatment. Then the government repealed it, the Liberal government, federal government repealed it, and these people are kind of being left in limbo. They don't really know what's going to happen to them or where they're going to go, and they're not being told any clear information. We know that both major parties have refused to settle refugees in the community, and they're kind of sticking to their guns, but they're not really saying what will happen to these refugees or when. So these refugees obviously don't have visas at this stage. They were meant to actually receive medical treatment and now they're not receiving it because the Medivac has been repealed? Well, the Medivac legislation was repealed in November or December, so the end of last year. And so their medical treatment isn't happening, but it wasn't happening really before then anyway. There were a lot of issues being reported with it. So Moz, who's one refugee that I spoke to, he's from Iran. He was on Manus Island for 7 years before being brought here. He's got severe PTSD and asthma, and he, in the time he's been on the mainland for medical treatment, has had one X-ray and literally nothing else happened. So their medical treatment isn't really happening, but I wouldn't say it's necessarily only because the legislation was repealed. We're in the middle of a pandemic, and the fact that we're in the middle of a pandemic is really highlighting as well the willful negligence of the federal government's treatment of refugees. Why is the Victorian government silent on this issue?
Yeah, I think it's a real blight on the Andrews government, but I don't find it surprising, unfortunately, because the Labor Party has been at the forefront of these policies for decades. And so Daniel Andrews can paint himself as a progressive, but in my opinion, he's basically just following in the tradition of the Labor Party, kind of in lockstep. That's kind of what they stand for these days. And I don't think they're going to change their minds anytime soon, just on the basis of goodwill or anything like that. I think I'm glad you are talking about the situation in public housing in Victoria today as well, because I think that is also an example of how, this state government treats poor and vulnerable communities when there's a virus threat happening. And it's an extremely punitive approach that's happening in those blocks at the moment, and is relevant to our work as well in the campaign, because a lot of those people in those public housing buildings either came to Australia as refugees or are the children of refugees. And so, even when refugees do live in the Australian community, they're often under the pressure of a lot of different, ongoing difficulties kind of enforced on them by the government.
Absolutely. And look, it goes without saying that we do need to overcome the virus, isn't it? We're not saying that the virus isn't relevant.
Oh, absolutely. I just think that you have to have a safe approach that puts people's dignity first, and I don't really think that the approach with the refugee detention locations is not safe at all. But the public housing thing isn't really what I'm here to talk about, but I think there are much
but it is linked, Meg. It is linked, though, because there are lots of Somalians there. There's a lot of refugees that have just arrived in Australia, as you say, and there's so much over-policing there. Can you imagine how frightened the people would be there, waking up to armed police?
Definitely. Yeah, there's a long history of police harassment on those blocks, especially in Kensington and Flemington. So, I mean, I think the way that they're dealing with it there, though, is just purely punitive. It's kind of, in a way, it seems to me they're trying to lock the virus inside the blocks and stop it from spreading into the wider community there, more than they're trying to keep those residents safe.
Is there evidence that the virus is actually in the blocks?
Yeah, people in the public housing blocks do have the virus. I think there's up to 50 people now as of today.
I hope not. I hope that's not what the issue, the thing is to lock people up because of the virus. If people do have the virus, they need to be taken to hospital and looked after or quarantined.
Yeah, absolutely.
Well, we're going to be hearing more from Tamar Hopkins about that. But, Meg, I want to thank you for actually linking that up, because it is important. A lot of people seem to think that the Nine Towers are filled with alcoholics and, drug addicts. And alcoholism and drug addiction is a public health crisis as well. But I suppose it's interesting how Pauline Hanson was kicked off Channel 9 for making the most dreadful accusations against the residents. And entwined in that, she's also mentioned that people need to learn to speak English, and this is all connected with refugees.
Yeah, definitely. I mean, there's no surprise that Hanson is one of the enemies of refugees, is also the enemy of the people living in those public housing blocks. I think whether or not they're refugees, but obviously there are a lot of refugees there as well.
Yes, not all, but there are quite a few.
Definitely, yeah.
And I believe, Meg, that there's been, Premier Daniel Andrews has admitted that Victoria's rapid uptick in cases is partially linked to transmission from security at quarantine hotels. Can you talk about that?
Yeah, so despite the fact that there was a lot of blame shifting going on in terms of a lot of talk about migrant communities and things like that, it's now been admitted that most of a large degree of their outbreak now has actually just been linked back to
the security operating at hotel quarantines in Victoria. And the situation there is kind of, a kind of familiar story for people who are familiar with Daniel Andrews' kind of neoliberal policies, because the security firms or the security jobs were kind of outsourced and privatised, run by these privatised companies, and the companies cut lots of corners there. They were reporting to the government that they were employing more security guards than they were there to get more cash from the government. And unsurprisingly, this kind of shonky deal turned out to spread the virus because people weren't using PPE properly, people weren't trained properly, and there's a lot of other rumours going around about what happened. But I think it's clear that the problem comes from letting a company that runs for profit deal with this situation. And the situation with refugees is eerily, has some eerie comparisons because, their detention is run by private security firms, namely one called Serco, which is quite infamous for different abuses and cost-cutting actions. And they've had some near misses. So in Brisbane, where there is also a detention hotel at Kangaroo Point, a guard there tested positive for COVID-19 a couple of months ago. Fortunately, it didn't spread. But it's very clear that if an infected guard was on duty, it would spread straight through these hotels, and probably every single one of the refugees would get it. They live in really crowded conditions with 65 people on one floor. They're kind of forced into contact with these guards, and the guards work on rotating shifts, and there's lots of them, and who knows what they're doing in their time off work. I doubt that they're self-isolating properly. And there are reports that they're not using PPE or anything like that. And these refugees don't really have any choice but to interact with them because they're there constantly, and they're the people delivering their food and going into their rooms at random times of the night without announcing themselves and without proper protective equipment. So it's a real kind of scary situation there at the moment.
Perversely, that was happening also. The private operators were also doing this with the guests of the hotel that were quarantined that weren't refugees.
Yeah, apparently, yeah.
It's perverse, really, Meg. An absolute
I think
atrocity.
It's really disturbing.
Absolutely. Well, like RAC, I've got no confidence that Serco or Australian Border Force will be able to manage an outbreak if the virus is brought into detention at the Mantra or the detention centre in Broadmeadows. And interestingly, I'll be talking about the Nine Towers later on with Tamar, but like the Nine Towers, the refugees also are running out of basic sanitary items like soap and other things, isn't it? Yeah, so there's been reports throughout the few months that there's an unreliable kind of distribution of PPE there. Not even just PPE, I mean basic sanitary equipment like soap, and that they regularly run out and it's not filled up again properly. So, on top of the fact that they're forced into interaction with these security guards, they're not given even things like soap. And I think it's clear that the conditions at these places are made basically as uncomfortable as is pretty much possible in what seems to be a kind of deliberate act to make these places, as unbearable as possible in just a bunch of different ways. Like the refugees there often have dietary requirements because of their medical conditions and they're supposed to eat certain foods, but they're provided basically microwave meals and they have no choice in what they eat and what comes in their meals. Often they don't eat for a long time because they're not supposed to be eating the food that they're being given. The constant surveillance and what that would do to your mental health when you're locked in one of these places. And then on top of that, now with with COVID, they can't have, and this just kind of underscores the need to release these people into the community. They can't have any visitors. The only visitors they have are security guards. Their visitor rights have been cut off, as have their outdoor rights. They're not allowed to go outdoors. They used to be transferred to the MIDA detention centre so they could walk around at times outdoors. But that's all stopped with the virus. So they're just stuck inside now, basically. So I want to really tell listeners, though, that Meg and I are not suggesting that
the coronavirus isn't real or that we need to address those issues. It's true, isn't it, Meg, that we do need to adhere to social distancing and hygiene and washing our hands. But what we are saying, or what's being said in this interview, is that conditions need to improve with quarantine and that refugees from the Mantra Hotel and indeed from other detention centres need to be released into the community with or without the pandemic. But the pandemic is dangerous, is doubly dangerous for the refugees, isn't it?
Yeah, I agree with that. I think I'm for a strict approach to social distancing and basically an approach to eliminating the virus, which I think our government is refusing to do at the moment. But I also think that actually the conditions in these places are a virus threat, and that these people would be safer in the community where they can socially distance like everyone else can, and they can be provided for, and they can be safe. I'm for that unconditionally, but it is the case that actually these detention locations are a virus threat.
Indeed, they are. They are virus threats. And the other thing is too is in regards to what's happening with protesters as well from the Refugee Action Collective and other organisations that have been demonised whilst they're trying to protest against this issue. Yeah,
there's been a pretty punitive approach to the protesting and a somewhat selective approach. So some protesters from the collective have been fined. There's some ongoing court cases happening for an action outside of Mantra a few months ago, which was socially distanced. People were in cars and, that abided by rules basically pretty much as possible. It was 100% safe. And then we were threatened with other kind of basically political interpretations of the health laws when we planned another protest at the Mantra Hotel, which would be socially distanced again in groups of 20, which was the limit at the time of how many people you could have together outdoors, with masks, with hand sanitizer, no more than 20 in one group. The police still threatened to fine everyone there. So, I think the approach here is not about the virus, but is more about a political approach and trying to deter people from protesting around refugee rights. And using the virus, the pandemic, as a way to silence protesters, even though protesters are adhering to the public health regulations. Yes. It's approximately 4:23, and you're listening to an interview with Meg Hill, in case you've just tuned into 3CR. Meg from the Refugee Action Collective, and this is the Doing Time show. Meg, do you have any final comments about what's been going on? Yep. Just that I think, if people are listening to this and they think that it's an outrage and they want to be involved in fighting, then there is stuff that's coming up then that people can be involved in, because I think the history of refugee oppression in this country, and even the recent history, but the whole history of it, has shown that our governments will not change their policies unless they're forced to. And I think that goes for both sides of the political spectrum and both major parties. And so, I'm an activist because I think that's the best way to fight for the rights of refugees. And I think that anyone else that agrees with that should come along. There's a few events planned. So the Refugee Action Collective is having an action on the 19th of this month, which we are having a meeting tonight to decide how that will go ahead, because we want to make it safe for everyone with the spike in cases at the moment. But nonetheless, there'll be something happening on that day, so keep an eye out for that on the RAC's Facebook page or on the website. And there is an action called by a bunch of different groups in August, from the 7th of 9th to August, which is planned to be held at the Mantra Bell City Hotel outside in kind of in the vein of the protests that we've seen in Brisbane recently at the hotel there where refugees are held, a similar kind of action. So keep an eye on both of those events and come along.
And what's the website, please, Meg?
The website is rac-vic.org, and the Facebook is Refugee Action Collective Victoria.
Thank you so much for coming onto the show, Meg. And, I wanted to also say before we finish that it's also the Liberal Party as well. I mean, we've got our own Peter Dutton, who's interesting to say the least.
Yeah, definitely. It's both.
And where are the Greens in all this?
The Greens have a better policy, much better policy than both of the other parties. I personally am against all detention of refugees. I think that can be processed in the community. And so the Greens policy for me personally doesn't go far enough, but they're definitely much better than the major two parties.
Yeah, we'll have to have a look at that sometime. That'll be for another show. But certainly there definitely needs to be a coordinated effort to assist people who are in quarantine, and that includes refugees, which is the topic of this interview, but it also includes, the people who have been locked down in North Melbourne and Flemmington as well, that there has to be proper assistance for vulnerable communities. Thank you so much, Meg, for coming on, and take care. Keep up the good work.
Thanks for having me.
Thanks a lot.
You're listening to 3CR Community Radio 855 AM on digital and online. 3CR Radical Radio.
COVID-19 is a sickness that can spread from person to person. It can be dangerous, especially for our elders or people who are already unwell. We can all help stop the spread in our communities. Cover a cough with the inside of your elbow instead of your hand. Wash your hands with soap for at least 20 seconds after you cough or sneeze. Go to the toilet and before you make any food. Keep away from people who are sick, coughing or sneezing. Avoid going to places where there are lots of people. At this time, it is best to stay at home and away from other people as much as we can. If you're feeling unwell, have a fever, cough or sore throat, or worried about someone else, phone your doctor, clinic or medical service right away for advice. It is important to stay connected and strong as a community and keep our mob safe. Visit health.gov.au or your local health service for more information.
Authorised by the Australian Government, Canberra.
A 3CR supporter.
Fitzroy Legal Service has launched a free information and advice phone service for people who have been stopped, questioned, fined or charged for breaching the new COVID-19 restrictions. Have you been fined or charged under the new laws? Or stopped and questioned by police for being outside?
Call 0434 136 501. Weekdays between 9am and 5pm. That's 0434 136 501. Or head to fitzroy-legal.org.au for more information. You can also report incidents at covidpolicing.org.au.
Fitzroy Legal Service is a 3CR supporter.
And you're back with the Doing Time show. And we'll be speaking shortly with Tamar Hopkins, former Principal Solicitor from the Flemington Kensington Community Legal Centre. And she's also been doing and has done extensive research in regards to police powers and racial profiling. I just want to start off an introduction by giving listeners a quote from Premier Daniel Andrews in Victoria. Our priority is to make the hard decisions to fight this virus and keep the community safe. And now we're supporting those Victorians who've made this possible, Premier Daniel Andrews said in a statement on Sunday. Basically, the chief focus for the 3,000 people now locked inside their flats in the 9 towers at Flemington and North Melbourne has been the shortage of supplies like sanitary napkins and food and toiletries. And I'm going to be speaking to Tamar about this very complex issue and really looking at, has there been a coordinated effort here? What's going on?
and what can be done to improve things. And certainly the Doing Time show is not saying that that the virus isn't important. We do need to eliminate the virus. But what's happening? What's happening with the 9 towers? Hello, Tamar. Welcome to the program.
Hi, Marisa. Thanks very much. So there's a bit of an echo on this call. So
yes.
You know.
That's because of the pandemic. There's been restrictions at 3CR, and I'm doing the show remotely from home, so the sound may not be as usual.
Okay.
Can you hear me?
That warning. I can. So, I've been in communication with one of the residents and part of a Facebook group that's been set up to talk about what's going on. So I have a little bit of insight about what's happening. And look, there's some incredible organising going on, amazing leadership from inside the flats, real solutions being sought out from the inside. I think everyone is quite appalled and shocked by the lack of preparation on the part of the state government in going into this hard lockdown without.
Can you take us through from the beginning? So what happened, Tamar?
Yeah, so on Saturday in the afternoon, there was an announcement from the Premier that as of the announcement that the flats at North Melbourne and Flemmington would be subject to a hard lockdown, which we understand meant that all the residents were not allowed out of their houses for any reason at all. So not for the usual 4 reasons that are provided to other residents that have been put into level 3 lockdowns, but were actually to stay in their flat, like full stop. So this gave people no preparation to get food, medication, extra things for their babies, things for their elderly family members that were living there, fresh food. There was no opportunity at all to prepare for this. It was suddenly under lockdown. Then it became apparent that the other thing was that the Premier ordered that there'd be 500 police put on the estate to basically police the perimeter and prevent people from going in and out. And we were told that there would be police on every floor and certainly in foyers and all around the centres, and roads are blocked off, have been blocked off. There was a real confusion immediately about what was happening. It looked like some of the residents in North Melbourne were able to get out to get medications just in that evening, but people in Flemington were locked down immediately, so there was a bit of inconsistency about what was actually going on. But now I understand that everyone is under a lockdown. And now the thing about this is that if people are unable to get out to get their needs met, then they are completely reliant on the state to provide those needs. And there is real concern that this has not occurred. There has not been adequate information provided, not adequate food. People are running out of, vital supplies for their children. Food that has been delivered we've heard reports that it's been cooked pies with ham inside, which is completely inappropriate. These are their homes. They can cook. They want fresh vegetables and fruit. And just while I'm on this point, I've just got a list of things that people are requesting. That's milk, bread, cooking oil, baby formula, masks, gloves, sanitizer baby products, fruit, vegetables, lentils, and that they're asking that it be dropped off at the North Melbourne Mosque, which is at 91 to 101 Boundary Road in North Melbourne. So they are...
Repeat that address again.
The address is 91 to 101 Boundary Road in North Melbourne. So people could take supplies there. They can be distributed to the residents. The other extraordinary thing about this, Marisa, is that this hard lockdown was only applied to the high-rise public housing estates. There are other high-rise apartments close by that have not been subject to these restrictions. The surrounding streets are not subject to these restrictions. So people are inside looking out over people who are able to get out go to their work, go to get food, and yet they are restricted inside. So there is a real sense of one set of rules applying to public housing tenants who are, a very highly racialised community versus everyone else in these communities, and that difference in treatment is profoundly shocking and profoundly dehumanising and traumatic, along with the fact that it's being heavily policed.
So why did Daniel Andrews do this? He's saying it's to protect people, not to punish.
Yeah, that's right. And I think that my feeling is that there is a real level of paternalism going on about, and not a lack of understanding of the incredible the capacity of tenants inside the building to manage this, to socially distance. They have been socially distancing for the months during this pandemic period. They went through the months of the lockdown that we all experienced without passing the disease on. They are absolutely capable of socially distancing. I think that there was a panic reaction without recognising the real skills and capacity of people to take care inside the building. And the other thing is, I guess they weren't offered the opportunity to go to a level 3 restriction like everyone else in North Melbourne and Flemmington were given. Everyone else has been given the opportunity to try something new. So they are. It's profound to be locked in your flat without access, without being able to get your own food. You're profoundly helpless in that situation. You're totally reliant on the state to provide for your care, and yeah, it's an appalling situation for these individuals, these people to be in. Quite shocking. So, I think that I understand that there is a real concern about the virus being passed around in these kinds of confines, but there must be ways of managing that while allowing people out to get their essentials. And that hasn't been explored.
What could have been an alternative?
So I guess there are a number of real alternatives. There are alternatives to the decision to lock these people down in this draconian way, in that why a level 3 restriction should have been applied with clear guidance on how to get in and out of rooms in a safe way. But the other, I guess, really appalling thing that's very shocking for residents is the way that these measures have come with a massive police presence, and that the signal that sends to people that they are not to be trusted, that that they need to be heavily policed in this way, sends a real signal that the government does not trust these people to follow the rules, and I just think that's just so appalling on so many levels. One of the things that really strikes me is that this is already a really heavily policed, over-policed community. There have been decades of complaints made by residents about treatment by the police, over-policing, being stopped and searched, being assaulted in public places, raids. Complaints have been made, civil actions have been made. People have participated in a major race discrimination claim in this area that went through the courts and settled in 2013, asking for changes in the way the police deal with people, reduction in racial profiling, and yet despite that history of over-policing, the Premier thinks it's appropriate to send 500 armed police to surround these buildings. So, I just think that's appalling, and there are absolutely alternatives to that. Why hasn't this been approached from health perspective. Why is it that we don't have nurses and social workers, information being provided by people who are not police? Like it's, this was a real opportunity for the government to try another approach. And I guess the other thing that we need to be really aware of is that we are right at the moment in the wave of the aftermath of the death of George Floyd, and the growing awareness around the entire community that police are not the solution to social problems. We need alternative methods. The governments need to stop relying on police to solve issues that are all about community. And this would have been a perfect opportunity for the government to step up and approach this in an entirely different way without using police. So,
use nurses and social workers, bring food and medical aid. And I find it interesting that the media, the mainstream media, is trying to portray it that way, but it's not really happening.
No, that's right. So my understanding is that the major outside force that people are experiencing is police. It's not social workers. It's not assistants. So, it's quite incredible, isn't it, that our government is so capable of mobilising police rather than the community. Like, how is it that the community is so underfunded, undervalued, under-resourced? Why do we not have community that can go in at the snap of our fingers? Why is it that we have police that can do that? I mean, that says so much about our society and its priorities.
Well, it's occupied territory. It's where this is a colonised state. It's a settler state.
Yep.
And when are things going to change here? And I believe you were telling me at the beginning when I first spoke to you, Tamar, about that you were talking to a resident and there's incredible organising inside. Can you tell us about that?
Yeah, so obviously I'm not there, and I'm really looking forward to the residents being able to speak out about this. They're incredible. There is just like amazing coordination, mobilisation. People are providing their own translations of documents, going around finding out what people need, knocking on doors. Like it's like this incredible response. The community will look after themselves on the inside. They feel abandoned by the state government, and they are looking after themselves. And I just think this is, quite an extraordinary moment in our state of realising that we can't. The community can only rely on itself, there's just like it's quite an amazing period to be living through. So amazing organising. I think we're going to see some really profound calls coming out of this from the community. Really watch this space. At this stage, they're very engaged in just survival, logistics, making sure they know what's going on, communicating with people. So their focus hasn't been communicating with the outside world. The media is the last thing on their mind at the moment. It's really a survival game. But watch this space.
How does
and
the
hopefully
food from the mosque get transported to the houses?
Yeah, I don't know the fine details of those logistics. I don't know how the mosque has managed to be that conduit, but it has figured out a strategy.
So just in case listeners have tuned in, so this is the Doing Time show, and you're listening to an interview with Tamar about the 9 towers that are being experiencing hard lockdown. Tamar, can you just repeat the information about the mosque and where people can drop off food?
Yeah, sure. So the North Melbourne Mosque is at 91 to 101 Boundary Road in North Melbourne. They're currently calling for bread, milk, cooking oil, baby formula, masks, gloves, sanitizer, baby products, sanitary products. They're after Panadol, basic kind of medical supplies like that. They would like fruit, fresh vegetables, lentils, garlic, onions, tomatoes. There was a call out for some injera as well. But one of the really crucial things is that they don't want cooked food. So they really want these people, that's their homes, they can do their own cooking. They want fresh food. So, that would be really amazing if people could get that to the mosque. I'll give people hang on, have I got the phone number for the mosque here? I haven't, but I'll just pull up.
It really is incredibly crazy what's going on.
It is.
You're right. Yeah. It would have been a rare opportunity for the government to assist, because it's not about, we do want to eliminate the virus, and there have been virus outbreaks.
Right. Yes, absolutely. And the community out there are absolutely attuned to that, and are right behind the elimination goal of the government. So it's not like this is a community that will refuse to agree to restrictions. It's just the level of restriction and the way it's been done, the draconian policed way it's been done, that is so extraordinary.
Well, they were involved with the lockdown when Victoria was in lockdown in April. There was no problem.
Absolutely. So, I mean, this is a highly educated, experienced community who have been living with this virus like the rest of us since the beginning of the year, and could have been treated in a totally different way to the way that they've been treated now. So, I just think it's that it's just that sort of paternalism directed to this particular group of people. And I just think, the other side of it is that if the government tried to do this to, say, housing in Toorak or a different part of Melbourne, they just wouldn't get away with it. It's just this kind of paternalistic treatment of public housing tenants. And I totally understand that the conditions are not ideal at all. Like, those flats are not ideal, but people have been living there for decades, and there's got to be a way of looking after, recognising the humanity and the kind of resourcefulness of these communities without subjecting them to the kind of lockdown that has happened. So I'll just give you the phone number for the mosque. Saeed is there, and it's 0411 287787. So that's Saeed at the North Melbourne Mosque. If people want to call just to check on what the latest requests are coming from the community.
And they drop it off, and what's the address again?
It's 91 to 101 Boundary Road, North Melbourne.
Boundary Road. How they're going to get it into the Housing Commission, I have no idea. I don't know if the police will let them bring it in.
Yeah, I don't know. They must have a special arrangement. So
they must have a special arrangement. Yeah, well, I'll call and inquire about that. And look, I think what needs to be emphasised, and look, I've had quite a few people saying to me, oh, good, let them be locked down. Maybe they'll listen. Or, most of these people are alcoholics. And it's so not true. Like, there's educators in there, there's health workers,
That's right.
And even if they are alcoholics, it's a public health issue anyway.
Yeah, that's
there's
right.
Alcoholics
Absolutely.
Everywhere.
That's right. And if they're alcoholics and they're suddenly cut off from their alcohol supply, you have a major health issue. So, are people's drugs getting in there? If they've got drug addictions, are they having access to the drugs that they're addicted to? That's a real issue. Are we going to see? Who knows what's happening? But there are people with major disabilities in there that need access to the medications that they're on. And I guess there's real concerns that the government has thought all that through, but can't even make sure that there is food arriving. How can we be certain that medication and other, vital needs, including people's access to the drugs that they are addicted to? So, yeah. Really,
Premier
concerning.
Daniel Andrews compared this to that this is no different to aged care. Seriously.
Yeah.
No different to aged care. What does that mean?
Yeah, I know. I know. When aged care have their workers, their care workers, these people don't have care workers, you know, like it's a really entirely different situation. And the same is true with a ship, you know, one of those cruises. Well, they're used to being, the ship is set up to provide for all of those people every day, provide all their meals, all their needs. Like, who is set up to provide all the needs of the residents in these flats? There's no one. So it's an entirely different
coordinated
situation.
effort whatsoever.
Yeah, it's quite. I mean, really, this is a big eye opener for all of us in terms of, you know, does the state have a handle on the decision that it's making? Has it really thought these things through? And I think this was far too rapid a decision. And I get the kind of need to protect lives that's going on, that, you know, you want to save lives, and that is obviously a really primary focus for everyone. But that you have to just, you don't want to be killing lives in the process of saving them. And the other thing is that we want to be we are a community that needs to go through this together, and to single out people for, you know, extraordinary treatment is wrong. We need to, this approach needs to be all people in one suburb treated in the same way. Just the documents that the government has released around just defining people as detainees. So these people are no longer citizens. They are citizens, but they're defined as detainees now. Now, this is an extraordinary situation that we have. Legislation, delegated legislation that's just come through, creating thousands of people have just become detainees of the state.
The people in the flats?
That's right. They're now...
The people in the flats are entitled detainees?
That's right. They've been defined as detainees under the delegated legislation that was passed a couple of days ago. So it's, you know, we've created a whole new class without the kind of people, without the kind of support that was required in order to do this. So, yeah. So if I could just, I've got a list of demands that came out yesterday from the residents, and I have to say that obviously there is no single person or single group that can speak on behalf of everyone. So, you know, obviously these are just demands that a group of organised residents have made. And I also want to note that 24 hours ago, so things change rapidly. But anyway, so they demand that we aren't stopped from leaving our homes for 4 reasons: work, education, exercise, medical care or caregiving, shopping. So they want to be on the same lockdown that the rest of North Melbourne and Flemmington are on. The second demand is we demand the removal of all police officers from the building, and a maximum of 2 police officers present in our community. So that's, at the moment, 500 police. That's 6 residents to 1 police officer. That's just extraordinary that that's happened in our state. Third, we demand rent beginning 5 July to be suspended until further notice. Since these set of demands, I note that the government have agreed to make emergency payments for people. I'm not sure what's happening with the rent, but
there's 2 weeks free rent. There's 2 weeks free rent.
Great.
They don't have to pay.
Yep. Great. Okay, that's good. Fourth demand is we demand testing stations without police presence within walking distance of all lockdown buildings. And fifth, we demand transparency and immediate transfer of funds to residents raised by other entities. So there have been some fundraising, and I guess residents are concerned that the funds that are raised, which is, it's great that people are contributing, but we need to make sure that those funds are getting to residents. So that's just, I think, something to kind of really check through when you are making a donation that is being made to an organisation that has direct links to residents, and can make sure that money gets to those people. Yeah.
Thank you so much, Tamar. And lastly, the virus itself. I mean, what's going to happen with people who become ill with the virus, who have been diagnosed with the virus in those flats? How's that going to be monitored?
Yeah.
Because apparently there's been a small outbreak in there.
Yeah. Yep.
What are they going to do, lock it in there?
Yeah, I don't know. Great question, Marisa.
That's crazy, Tamar.
Yep.
No proper coordination in this at all. Nothing at all. No preparation. No nothing.
Yeah, yep. I think that's one of the huge lessons that needs to be learnt from this, is the essential nature of providing, of thinking plans out before enacting them. Yeah.
Absolutely. Tamar, we've got a couple of minutes left. Thank you so much for coming onto the show, and you've just heard an extended interview with Tamar about the hard lockdown of the 9 towers. Keep up the good work, Tamar. Thank you so much.
Thanks, Marisa.
Thanks a lot. Take care.
You too.
Hi, we're the Marindas, and you're listening to 3CR Community Radio 855 AM.
Isolated? Quarantined? Need some essentials but can't leave the house? Or just having a hard time dealing with everything at the moment? Queer Aid NARM is a new mutual aid group of organised volunteers. We're here, we're queer, and we've got your back. Whether or not that's how you identify, nobody should be suffering because capitalism or the state didn't provide what they needed. That's why we're working to strengthen our communities through solidarity. Put in a request for help and we'll match you with a volunteer in your area who can either pick up groceries or other essentials for you, help you run errands, cook meals for you, or check in with how you're going. If you or someone you know is having a hard time, or if you want to join the volunteer list, find us on queeraidmelbourne.org or search for us via Facebook, COVID-19 Queer Aid NARM Melbourne. So tell your family and your friends, and don't forget your neighbours. That's queeraidmelbourne.org, a 3CR supporter.
And we've got a couple of minutes left of our show, and it's goodbye from Marisa, and also goodbye from Peter and Rob, who aren't here. Yeah, so we'll be going out with our theme song, Black Fella, White Fella from the Rumpy Band. Beyond Zero is up next. Tune in every Monday for the show from 4 till 5 for the Doing Time show. Take care and stay safe. Bye.
As long as you a true fella, as long as you a real fella.